Typically around 4 to 6 weeks is when we can start progressing into some weight bearing in into our arms and start increasing the range of motion more towards full range of motion and starting to get a little bit of stretching if that feels comfortable. So we can start in hands and knees position and just start getting a little bit of that contact to the ground, putting weight through that arm. We want to make sure our wrist is lined up with our shoulder and our knees are underneath, and knees are lined up with our hip bone. So we're in a good alignment. We want to be conscious not to overextend our elbows, keep a soft bend, a nice tuck with your chin. And you can just start here going through some cat-cow. So letting your head drop, arching the back up, and then looking up and letting your back hang down. And getting some mobility into your thoracic spine and getting some movement there. And then from here, we can work our serratus anterior, which is the muscle deep to our pec in the front side of our shoulder blade, and it's a big shoulder stabilizer, and that's going to be a really important muscle for us to work after surgery. So same thing, I can find this position, soft bend in the elbows, nice tuck with the chin, and to work that muscle, I can drop my chest down and then punch it back up. Drop my chest down and punch it back up. So it's coming from the front side of my shoulder blade and my scapula, working that serratus anterior. And then if we come into a nice comfortable sitting position, or you could do this lying down, we can come into some chicken wings. So if I place my hands behind my head, I'm going to start with my elbows by my side, bringing them out into that wherever it feels comfortable in that stretch position. And then I can add a nice side to side motion, getting a nice side body stretch. Good. And then I can add a little bit of rotation to get some movement into my mid back. And you should feel a stretch across the front of your chest as well. And then you can just go into some chicken wings, bringing the elbows in, bringing the elbows out. Bringing them in, bringing them out, breathing in as you come back together and as you rest, and then breathing out, exhaling as your elbows come apart. Good.